everyone, we're nursing students from HBU. My name's Allie, Anthony, and Veronica, and today we're going to talk to you about coronary artery disease, ways to detect, treat, and prevent it. So Veronica, can you define CAD?
Yes, so CAD is basically a blood disorder that affects your blood vessels. So this basically, what it means is that there's these arteries that are in charge of providing your heart with oxygen. And so these arteries, there's another disorder that's called atherosclerosis, which is one of the major causes of CAD. And this basically means that there's buildup, there's plaque in those arteries, and it prevents that oxygen, that blood supply from reaching your heart, and it causes your heart to be oxygen deprived. So I'm going to give you guys some quick stats about CAD. It's one of the causes of one third in the United States. And it is more common in the middle-aged male population, but once males reach 65, then it's equally common in females and males. It is more common in whites than African Americans, and so this disease is geographical prevalence for you guys. This disease is more common in the southern eastern part of the United States. So Texas, Louisiana, Mississippi, those are the areas that are mostly affected by CAD. And so we're going to talk about how this affects HBU. So can you guys think of a way that CAD can affect HBU students, staff, faculty?
Sure. I would say our diet is a major cause of CAD.
Definitely. And well, here at HBU, we have Chick-fil-A, and is not necessarily the healthiest option. But there are limited options of food choices here. So a lot of us, we eat Chick-fil-A, but Chick-fil-A is not good. And the other thing is that some of the food that we have here might not be as delicious, or as we might not feel full with whatever all the sandwiches and all that. So that's definitely one of the major fact that can cause CAD, which Ali will go into details about that later. But another thing is physical inactivity. So for example, we have the gym, but the gym, you have to drive to get there. And so that kind of causes students to not want to go to the gym. And not to mention that the faculty and the staff, they don't have, the gym's not free. So they have to pay a membership just in order to get that physical activity in. And not only that, but during the summer, students, when we have time to actually go to the gym, we have to pay for it. So those are kind of just some things that might prevent us or might not make us not want to go to the gym. And well, not to mention that we're already stressed, we don't have time to prepare our meals, and we live a sedentary life, just constantly in class and studying for exams and all that stuff. So clinical manifestations for you guys. So what are the signs and symptoms for CAD? So I'm going to divide this in like 3 categories, and we can go from there. So the first one would be chronic stable angina. And so this basically means it's pain. It's chest pain. It can be described as indigestion. It can be described as a burning sensation. And this pain is predictable. And when I mean predictable, I mean that you can predict when you're going to experience this pain. So for example, you go for a run, okay? And when you're running, after you stop running, you feel this pain. And this pain, it usually lasts from 5 to 15 minutes. And so, but when you stop running, then that pain is relieved. And you can kind of predict when this is gonna occur. So every single time that you're doing this, you're like, oh, I'm gonna have this pain, I'm gonna have this pain. So that would be kind of like the first little category. The second one is unstable angina, which is, this basically means that this is unpredictable, and this is an emergency. So this pain, you will just start feeling it when you're at rest, when you don't even have to cause an exertion or anything. It'll just occur. And this pain, it's new in onset, and it worsens. And then finally, there are other signs and symptoms can be fatigue, anxiety, shortness of breath. And then so finally, the last one is a myocardial infarction, which is also known as a heart attack. So the signs and symptoms of a heart attack this is the hallmark. So this is what you have to remember. So it's immobilizing pain, severe, that it does not subsidize when you change your position, when you rest, or when you take medication. So this pain will continue on. And now this pain may radiate. So it may radiate to your lower jaw, it may radiate to your neck, it may radiate to your arm. And this, some patients, not everyone, but some patients may experience nausea, vomiting, an increase in temperature. And just, it's important to remember that not everyone will experience this pain, but they might feel heavy pressure, tightness in the chest. So these are just kind of some signs and symptoms that if you experience them, then you kind of will have an idea of what next. So as I mentioned before, Ali's going to talk about the risk factors for you guys. So Ali.
So Anthony, can you tell me a risk factor off the top of your head?
Definitely would be smoking.
Smoking is one of the modifiable risk factors, along with obesity, diabetes mellitus, elevated blood pressure, elevated cholesterol level, also physical inactivity, and like you said, tobacco use, and diet and substance well. Those are some modifiable risk factors, things that you can change. And then we also have non-modifiable risk factors, which is age, genetics, ethnicity, what else? Some things that you can't change, like family history as well. And so now we're going to go into some diagnostic tests that you can use to confirm CAD. And so some diagnostic tests you would use is physical family history. You would ask them if they've had any family history of diabetes, hypertension. You would also use a chest x-ray, ECG, cardiac stress test, lipid profiles, and serum electrolyte levels. This is measuring your cholesterol and your sodium in your body. And the doctor may also want to perform a cardiac catheterization. And this is an exam used to provide, you're gonna look age and also check for the blood flow of the heart.
Right.
And Anthony will go into some treatments later with cardiac catheterization.
So is this disease communicable? Like, can you pass it from one person to another?
No, you can't. CAD is not communicable or contagious. It is used just strictly from the risk factors.
So Ali, how do you prevent this?
How do you prevent this? You're going to prevent it by your diet, your exercise, compliance with medications, and also stop smoking. And some of the complications with CAD is chest pain, heart failure, heart attack, which Veronica explained earlier. It's a myocardial infarction. And then dysrhythmias, which is an abnormal heart rate. And so for some of the diagnostic tests for myocardial is troponin. You would also check the cardiac enzyme levels.
Oh, wow. So Anthony is going to go into a little bit of treatments for CAD.
Oh, treatments. Okay, so you're going to break it up into two parts: heart healthy living, lifestyle changes, and medical procedures and surgery. So with heart healthy lifestyle changes, first things first, you're going to talk about your diet. So with diet, we're talking about low sodium, so no French fries, food, soy sauce, or none of the extra additives you put on your meats and stuff like that. And next part of diet is low cholesterol or bad cholesterol. So with that, your animal fats, your butters, your cream cheese, your sour cream, and just all those fats you get from an animal. Okay, so after this, we're going to talk about inactivity. It's recommended you have brisk walking, 30 minutes a day for 5 days a week, and that will definitely help out with reducing and preventing and treating coronary artery disease. Another aspect is smoking. I used to be a former smoker myself, and I can't stress this enough. Smoking is terrible for your body, your lungs, your heart, just every aspect. So just you want to quit that as fast as possible. Managing stress is a huge thing with having a heart attack. So you want to live in a way where you're not screaming. Don't drive on 290 or Beltway 8 if you can avoid it. With that, we also have medications. And with medications, you want to lower your blood pressure and lowering that cholesterol like we were talking about earlier. So with medical procedures and surgery, we have a percutaneous coronary intervention. So basically what that is you have like a catheter that goes into your artery where the blockage is at, and there's a balloon with a stent, and the balloon inflates, and the stent locks out. It's almost like a chicken wire thing, and it locks out, it opens up that artery, and it's permanent, and that basically increases blood flow to the affected parts. Another surgical procedure is artery bypass graft. is basically taking an artery or a vein from another location, which you don't need, and going past that blocked artery. So it's just going to go around it to provide blood flow to the affected areas. Some financial burdens of coronary artery disease. Oh man, according to the American Heart Association, financial burdens, let's see. From 2010 to 2030 is going to increase from $273 billion to $818 billion. So that's 3 times as much. So it plays a huge role in medical costs for the United States. And the cost per individual with CAD, it's around $19,000 a year. I don't know about you. I don't have $19,000 hanging around.
No, definitely don't. So what are some emotional and spiritual effects that this can have on a patient?
Oh, yeah. So according to the National Heart, Lung, and Blood Institute, living with CAD can cause fear because you're afraid of having a heart attack. You're going to have anxiety, depression. You feel like life's over. And the most important aspect is stress. Like you're saying, stress is a risk factor in the causes of these heart attacks. By having stress with CAD, it just basically perpetuates this vicious circle and adds like a compound effect.
But there are some resources and some rehab for this, right?
Yeah. With resources, one of my favorite resources I found so far is the American from the American Heart Association, heart.org, and they provide basically nutrition guides, diets, physical activity, a plan, support groups, meetups. They provide all this information for individuals with CAD. And if you guys are interested, after the video, there's a link in the bio. You can go check it out. It's pretty awesome.
And for the rehabs?
Oh yeah. So with there's also rehabilitation centers, all located around Houston. So there's huge benefits with cardiac rehabilitation. It's been proved to decrease blood pressure. Patients were able to lose weight. It can even reverse the hardening of your arteries. It's crazy. It's awesome. There's lots of located in Houston, Houston Methodist, Willowbrook area, Houston Methodist West. We're gonna put basically all these locations with some of them, and with phone numbers in the bio. So after the video, if you like it, just go check it out. Thank you.
Yeah. Well, thank you guys for watching, and we hope that you learned something about CAD. And so just remember, no Chick-fil-A. Go get a
And walk 30 minutes a day.
Quit smoking.
Yeah.
Thanks, guys.
Thanks.
Bye.